My name's Craig C. I'm a general and trauma surgeon who works with Stat Surgical. I think there's really three sort of, I'll say, genres of surgery that you can think of. One, we would say open surgery, and that means big, wide open incisions with a lot of exposure. And that's how surgery was founded and created, and that's how we learn to do procedures. After that, people started to think, how can I do surgery with less physiologic impact and less pain, less exposure to a colder environment, et cetera, and that developed laparoscopic surgery, and laparoscopic surgery was the first minimally invasive surgery in general surgery. That's where we put small instruments through small incisions into the abdominal cavity and blow it up. Now, the advancement of robotic surgery, robotics really is a form of laparoscopic surgery. We still use the same principles, but now instead of instruments that we need to hold with our hands, we have the Da Vinci robot, which is holding the instruments, and that does a couple things. Number one, it makes it more steady. It takes away any small tremor that a human might have. Number two, it takes away the fatigue of being in an awkward position to have to hold those instruments. And also it allows us to bring the scope and the instruments into positions that you aren't necessarily able to do laparoscopically. Another big innovation in robotics is that we have what are called wristed instruments. So a laparoscope will have a straight stick where almost like you're using chopsticks. In the robot, they put mechanics so we can move the tip of the instrument like a wrist. I can tell you, for a surgeon who does a lot of cases where I need to do a lot of sewing, it just makes it a total different operation when I can do it that way.